Yeah, hi, Dizon. I am a medical oncologist, professor of medicine at Tufts University, and chief of the service line in hematology and oncology at Tufts Medical Center. Right. Well, I think it's really important for the general public to understand that breast cancer isn't one disease, that, our treatments are stratified based on what type of breast cancer one has, whether estrogen is feeding that breast cancer hormone receptor positive, whether it is acting independent of hormonal pathways or triple negative, whether there's an overexpressed protein and pathway involving HER2 or HER2 positive breast cancers, and then whether all of it's activated, so the triple positive disease phenotype. And the progress that we've made in breast cancer has been to identify treatments that work for each specific subtype of breast cancer, and then launching lines of research so that each of those types of breast cancer are actually being evaluated in very separate clinical trials. So the upshot is the type of breast cancer, its molecular picture, what it looks like under the microscope, is a far more and bigger driver of how we approach your disease rather than just using that term of breast cancer. Well, liquid biopsies, for at least in breast cancer, they have become part of our general way to approach the disease. For example, in one specific type of breast cancer that is hormone receptor positive, we know the treatments that work to block the estrogen pathways. There are, there are multiple types of drugs that can work, but with one specific mutation in ESR, the evolution of that mutation is associated with resistance to these usual drugs. And we can pick that up with a blood test. You can actually find that mutation. And now if we do, in someone who has other evidence that the cancer is getting worse, there's a new class of drugs that works against that mutation. There's another type of mutation that is seen as well, most often in hormone positive breast cancers, involving PIK3CA, which is a protein that leads to cancer progression. And there are drugs that actually address that as well. So very often, liquid biopsies are being done for the purposes of choosing treatments that are predicted to work.